From your perspective as the WHO Director for Climate and Health, what are the most significant aspects of this resolution, and how do you see it shaping the global response to this crisis?
Why the global resolution on climate change and health is a landmark? First, because the ministers of health who were here in Geneva, together with the global health community, because it's not just the ministers of health, it's the global health community, they first put the evidence on the table, saying, yes, climate change is affecting our health. Yes, there is a role for us as the responsible for health to do something to convince our governments of doing two things. One, reduce emissions, mitigate the causes of climate change. A second, prepare our health systems to cope with this massive threat that is representing climate change for our global health and our communities. We need as well to reduce our own carbon footprint. We need to make sure that we respond to the crisis that people are already facing, and we need to use our voice, the power of the voice of health, to convince governments to do three things: accelerate the transition to clean sources of energy to stop this disaster. Second, to accelerate the transition to sustainable food systems with what these represent. And third, accelerate the transition to better planning at the urban level of what our cities are for the people that will be living in urban areas, which now represent more than, in a few years, will be more than 70% of the global population.